Good evening, ladies and gentlemen. I will call the Budget, Finance, and Investment Committee to order. The first item on our agenda is to approve minutes for our November 10th meeting.
So moved.
Commissioner Schaefer, thank you.
Second.
Seconded by Commissioner Sanders. Any additions and or corrections? All in favor, please say aye.
Aye.
Thank you. That motion carries. I am just going to give a brief report for Mr. Beatty tonight. No bids were taken this month, and the LGIP interest rate remained and stayed at 0.12%, which is the same as last month. But he did think it would be important tonight for us to announce that those who want to pay their property taxes in this calendar year, his office will be open on December 30th, even though the other county offices will be closed that day. The Murfreesboro Trustee's office will be open on December the 30th from 8 to 4:30 for those people who want to pay their taxes before the end of the year. And that is the trustees' report.
Motion to approve.
Thank you, Commissioner
Second.
Sanders.
Very well done.
Seconded by Commissioner Fee. All in favor, please say aye.
Aye.
Opposed? Thank you. That motion carries. If you will please locate your fund condition report, our finance director, Mrs. Nolan, will begin with the development tax report.
In November, we received $36,750. That brings our total for the year to $352,500, which is not especially the best month ever.
Any comments about the development tax?
It's probably the lowest
Yes.
year-to-date we've ever had.
We sort of looked at that this afternoon and we said, it is what it is, right?
Is that the lowest month we've ever had?
No.
We did have,
December and January, I wait on that.
we did have one more, yeah, I think I remember 13.
Pretty close.
Yeah. In December of 08 or 09. Okay, gentlemen, let's continue with our cash balances.
At the end of November, we had $116,719,000, with $99,086,000 in operating funds, and I would say borrowed, but some of it is for capital that wasn't borrowed money, was $17,632,515.
You say that's not borrowed money?
Well,
That's-
and the reason why I hesitated, if you remember, and I'll bring your attention to the general fund, you see that we had a drop in our cash balance because we did transfer almost $2 million out of that. That was not borrowed money into
Right.
the capital projects.
So that's where that's showing up, okay.
So it's moved down there.
Looks like somebody make us a gift, or, I don't think so.
So, but that was one reason why I did want to bring that to your attention, that it did go down. That was the reason for our cash. And again, if you remember on the debt service fund, we have transferred $15 million out of that fund into the operating funds too. So it is borrowed, we just borrowed from ourselves.
I guess was asked, I don't know if it was last time, the campus school renovation thing, what are we waiting on there?
It's completed.
Well, campus school renovation, they still have,
Oh, what do we, no, I think you
showed
said
us zero.
what is lacking, and I think that is out of that.
Fund 177 has a budget in it for
Okay.
that project this year.
Okay.
Anything else on cash balances? Do you want to say anything about the
On the
revenue
revenue.
sheet?
the general fund, if you look at the comparison at the bottom line, we're at 25.61% complete on our revenue, and that compares to 25.37 on the general fund in the prior year. So, yeah, we're a little behind on property tax compared to last year, but compared to all the previous years, the collection percentage-wise is right where we should be. But when you're comparing back to the previous year, just 1 year back, we're a little behind. But that's just really 2 months of paying bills. But, when we finish December, we have a lot of people who pay in December, so that'll be a big test as well as the end of February where we start. But the other thing that I make sure of is, as far as what did we budget to what was the actual tax levy, and we budgeted conservatively, so we got a little safety net of about $400,000 there. The solid waste fund, on the other side, that's doing well. They're seeing results from picking up now from the hail damage. They'll have increased tipping fees. The sales tax that I brought down quite a bit is not as bad as what I had projected, so that's looking better than what I had budgeted. Also, sales tax for schools is at 5% more than what the prior year was, so that's a good thing too.
Any other details?
Move to approve the report then.
Commissioner Jernigan, thank you.
Second.
Seconded by Commissioner Fee. Any further discussion or questions for Mrs. Nolan? All in favor, please say aye.
Aye.
Thank you, that motion carries. Mrs. Stinson, our insurance director, will join us, and she will begin with her financials.
If you refer to 9264, we'll start with our health plan. For the month of November, our per employee per month is $685.07. When we combine the clinic experience, we're at $762.67 compared to a prior year-to-date average of $721.97 for same year-to-date. The one thing that two things I want to mention on here is when we look at the on-site medical, the number of office visits being reflected is 856. In a conversation with the representative at Take Care, I learned that the way that they were accumulating office visits was different than the prior vendor had accumulated. They were counting only visits with either a nurse practitioner or a physician. And some of the efficiencies that we gained with the new contract is the use of medical assistants so they can do the lab draws and things like that before would have required you to book a 20-minute appointment through the nurse practitioner or physician. And I have asked that they go back in and they include all services regardless of who the provider is so that we can more accurately compare prior vendor experience to current vendor experience. As an example, we gave over 1,300 flu vaccinations in the month of October, and that particular number is not reflected in these office visits. The cost you see at $391,520. Up to this point in November, we had not received any billing from Take Care because of their audit process. So we have just now paid implementation 2 months operational cost in the month of November. So that's why that's such an exaggerated number there.
So the total number that they put down was 856, is that correct?
Yes, sir, that's
Like at
right.
1 o'clock.
And that
That's
reflected,
for how long a period?
that was for the month of
Exact same
November, but that
number.
reflects
Tell her
just
that's
nurse
all we need.
practitioners and the doctor, right?
How do they schedule those? how many visits per hour do they max out
It
at?
depends on if the person has been previously seen or not. So if it's an established patient, they will schedule those at 30-minute intervals. If it's a first time, it's still at an hour.
Well, I was wondering about that. If you look at the website and you pull that up, I've heard that they're only giving 1 hour blocks. You know, people have asked me why they're not showing all the blocks that are available. You have to basically put in a date, and then they'll give you what's around that, but they won't show you everything for the week that's available.
So there's different,
I haven't looked at it myself. I'm just going by what people
no,
told me,
right,
so.
and there is truth in that. There's different appointment types that you can schedule. So if you go in and you select consultation for illness or injury, the system will go ahead and put you on a 1 hour schedule. Now, one of the things that we have is receptionists, 2 receptionists in our clinic. So they will go in and check the schedule and modify it out so that it will actually pull them into a more appropriate time slot. So that as they're receiving phone calls for people that don't use the portal, then they will go in and schedule those people in that additional 30 minutes. So if you schedule an hour online, you're an established patient, they modify it down to 30 minutes. If I call, then there's a 30-minute time slot for work in.
So they can see 16 people a day on a 30-minute schedule, right?
Depending on what clinic it is and how many hours they're open.
So 16 people times 30. And then how many clinics have we got?
We have 5 locations.
Okay.
They're open different hours.
Right.
Right.
But you get other things with what he's saying. You've got to know what their code is when they give you the list of 7 or 8 different options to choose what's the matter with you.
Well,
Now, and if you're not a doctor or a nurse, then you may not know.
right.
I'll be honest, I've gone online and I look at them and I put down, and I thought I put down what I wanted, and it was over a week away. And it was because, you know, I was running cold, chills, whatever. And so that's not going to do me any good. So what I did was called them up then.
Mhm.
And, you know, that uses a person. Because before, with the old one, you could look at any one of the different sites, and you could see what was open at each one, and you could look at days in advance, so you could try scheduling something, you know, a week in advance if it was something, you know, that was critical right then if you weren't sick.
Right.
Now you can't.
You can't see all the sites at once, right?
Mhm.
I have reported that to them and asked them to take a look at it. I'm giving them feedback regularly about the portal, so they are making modifications. But to address his point about the schedule, so if you go in and you select labs, that is done by a medical assistant, and those are 15-minute intervals, and there's a different calendar in the system that tracks those particular type of appointments.
Well, I mean, to me, it looks like it'd be beneficial if they could see the full schedule for the different ones, but.
Yeah, and I agree. I think that it will benefit some people. If you are like majority of our people that use the clinics, that really, you either use one or none, because you really don't want to drive to other locations. You may not find it as beneficial, but for those of us that are willing to drive, it would be an improved feature.
Am I correct in my understanding on this, that some people have the same appointment schedule it every week?
So we had the 856 appointments, and of those, we had 490 unique patients. So the remaining balance had already been there once
So
during that month.
it could be. Well, so it's probably a lot more when you took this, the other people that they went to see.
How's that working out with us charging people when they don't show up? Are we having many no-shows?
You're talking about the no-show change that we voted on. It doesn't
Right.
become effective till
Till
January
January.
1st.
Okay.
Yeah,
One other question.
The increase.
right, the
Right.
Yeah.
increase, right.
We're still gonna get Commissioner Schaefer for not making his appointment a week later than when he already set it up.
Right. Now, a question, have there been instances where people have made an appointment and they've turned them away when they got there?
Yes, they will. An example is if you show up without your proper identification, they will refuse to treat. If you are a scheduled appointment, that would be the only reason that they wouldn't take a scheduled appointment. If it's the walk-in clinic, well, I take that back. The only other reason would be if you reported that you were coming for something and when you got there you needed a different service that they provided not at that location. So as an example, if you wanted a checkup and by putting down that you wanted a checkup, what you really meant was you're female and you want your annual pap smear and you go to Blackman, you're going to be turned away because that is not one of our GYN clinics. But that identification would be the only two reasons.
What about if you're late?
Or if you're late. And then the other instance would be the walk-in clinic is only open a certain number of hours in the mornings at Stewart's Creek, and they see as many patients as they can during that period, but once it becomes the regular schedule, then they won't see anyone else, so you may wait and not be seen on that day as well, which has always been, what we've communicated.
Okay.
Any other questions about this or the clinics I can answer?
Any other questions on that 264?
All right, we go to Fund 266. Year-to-date, we are at $260,016.82 compared to prior year of $250,444.23. I think we're at 1.02. We on our reported last month, and we're at 1.04 this month compared to prior year. Which overall, we consider that our population has increased. We're still doing well. With all the programs.
Motion to approve the report, Madam Chairman.
Thank you, Commissioner Simmons. That's seconded from Commissioner Fee. Thank you, Commissioner Fee. All in favor, please say aye.
Aye.
Opposed? Thank you, that motion carries. And Mrs. Stinson will present two proposals from the Insurance Committee, beginning with the proposal to remove option 1 for the 2013 benefit package.
Last year, whenever we discussed what we need to do in terms of increase in rate for 2012, it was discussed that option 1 at that time needed a 32% increase. Because we use a premium pool to fund our claims, the decision was made to hold rates flat and see what experience revealed to us and then make considerations for 2013. During the insurance committee, one of the insurance committee meetings, I had communicated that I would send a letter to all option 1 enrollees and provide them with a benefit and financial analysis of option 1 versus option 2. There's not a lot of difference between the two plan designs, and so we wanted to ensure that people were actually stopping to take the appropriate time during open enrollment to consider the plan options. What we found was that 72% of people in option 1 responded to that letter, did their analysis, and moved to either option 2 or option 3, which leaves us approximately 237 people as of January the 1st that are going to be enrolled in option 1. As soon as we close out open enrollment, because of the budget process, it's important that I go ahead and begin set rates for the upcoming year so that during the budget process we can finalize what our funding needs to be. And I've started the process of 2013 rates, and what it's revealed is that the necessary increase, and by necessary increase I mean that using a 21% trend like what we've seen in our financials and the experience that we have to date, the amount of premium that we would need to collect shows that the necessary increase to current premium levels would need to be in excess of 60% in option 1. So we had hoped in an effort of sending out the letter in option 1 that people would stop and actually consider the benefit versus the financial aspect. We have 237 people that still say it's worth paying the substantially more premium. So the question became, do we offer option 1 in 2013, or do we discontinue offering that because we know that in order to sustain it we have to take a 60-something% increase? and are there better options available to us? The proposal was made to insurance that we discontinue offering option one in 2013, that we look at other plan designs, we look at modifications to our current plans that are existing, so that we can offer plans that are both benefits appropriate and that are better defined in terms of cost for our employees. And the insurance committee voted unanimously to not offer option one in 2013, and so I brought it to you tonight for consideration.
This 60% increase,
Mhm.
will that affect the other options, or is it only option one that will be affected in those 237 people that are opting for that? Are they the only ones that would be affected?
Well, only for option one does it show that. And the other options, option two needs a rate increase as well. I mean, we're trending at almost 21%. Option two, and there are some variables that will affect what the final percentage is, but those things will be, like our medical is currently out to bid, so what the administration rates come in will affect partially what percent needs to be taken. We'll have additional months of experience by the time that we finalize rates, and that experience will drive what percentage needs to be taken. But there will need to be some sort of rate increase inside of option two as well. And we'll need to further define what that is after we put the new experience in.
Even if you do away with option one entirely, you're still looking for a rate increase in two?
Right.
Do the recipients in option one pay the 67% increase? They're the ones who pay it.
Well, we would know. The county funding would pay part of it, and then the employee contribution would pay part of it. So right now, the county pays 77%, I believe it is, of option one's premiums.
So if it goes up, up dramatically, then the 77% is going, 77% of the new increase.
Right, I was wondering if the portion paid by the recipient would go up enough to encourage them to leave the option anyway, but.
You would have hoped that whenever we mailed letters out to the homes that showed the difference in the premium, that would have motivated. In family coverage, it's in excess of $1,000 a year. And so you have to assume that if people see that in black and white, assume they read the letter, you know, there are some people that can budget to the known. It's the unknown that scares them, and they can budget to the excess premium. But being called upon to pay that $200 out of pocket in deductible is a more fearful proposition to them than the additional premium that they have already grown accustomed to paying anyway.
Well, the coverage is the same for option one and two, other than the
That's right.
deductible, isn't that correct?
And the
So
annual
as far
out-of-pocket
as-
limit.
Okay, right.
Right.
But I mean, as far as what's going to be covered, nothing changes between
Correct.
the two options.
That's
I
right.
want to make sure I had that clear.
Well, it's
so.
educational. People are just so used to being in option one, they're afraid of change. And this may actually force people to open their eyes and realize in most cases they're better off. They're paying $1,500 for $700 worth of coverage or
Right.
something like that.
And, you know, we're going to have, option two already shows that it needs an increase. We're going to try to look at, like I said, the plan design and other factors to try to control that increase as much as possible. But insurance it is complicated, it's complex, it's intimidating to people, and to me, this is one of those decisions that we need to make on their behalf and know that that there's a responsibility in this process to us to go back in and offer other options that are well balanced in terms of benefit and financial cost as well.
She is going to prepare other potential options in addition to two and
Correct.
three, plus
Right.
maybe even modify two and or three, but there will be some others.
Right, and the reason it's important to bring forward option one and know what the future of option one is tonight is because during the process of looking at plan designs and determining premium levels, if we continue with option one, then it's status quo. I just figure out what the rates need to be presented. If option one is not there, then we need to go in and define new options, as well as when we take option one out of the equation, then we have to make certain assumptions into those other plans that we wouldn't have to do if option one was still there. because we have to make assumptions about what those 237 people will do, and that affects the rates as well. So that's why it's important to understand tonight, and that's why I didn't bring simultaneously a proposal on what the new plan design would be, because there's, like I said, there's some variables that I need to better understand before I can do that.
The recommendation from the insurance committee was to remove option 1 from the 2013 benefit option. I think part of the motion, Mayor Burgess, was that Mrs. Stinson would continue to look at other
She's going to bring other options.
Right.
To the insurance
Okay.
committee as soon as they're available.
That was part of the motion, wasn't it?
This is 2013, not 12. And
Yes.
it
Right.
sets us on the right path down the road to make the hard decisions during the next calendar year, which that mostly has to be done before budgetary times. But if we don't do this now, and we don't, and you and your staff spend all that much time getting all that prepared, and everybody says, oh, maybe we'll leave option 1 in. That's been countless staff hours wasted, and then we have to back up and start all over. I'll make a motion to remove option 1 as presented by the insurance committee with the rest of the recommendation. Whatever it was.
Commissioner Jordan, thank you.
Second.
Seconded by Commissioner Shea. For discussion,
Was,
Commissioner P.
what was the vote on the insurance committee? Was it unanimous to
It
do
was
away with
unanimous.
It was
this?
unanimous.
Yes, it was.
I mean, was there any discussion y'all saw that might make me feel better about this?
There was
or
a lot of discussion. There was discussion from people from the
She's
school system.
She's
and
covered it pretty carefully, though, I believe.
Yeah.
You can see over the last, since 2010, just 2010,
Yeah.
the number of participants in that option has declined from 906 to 237, so it's not a lot of people left in it.
And we had talked about option 1 back during the 2012 rate process, and that was when we discussed sending the letter, hoping that people would kind of take care of the problem for us that we saw at that time. And we had a good response, but we also knew that if we still had people remaining in that option, that we would have to have the discussion to remove it.
Was there any discussion that if you left an option like option 1 in there, that you would let the people pick up more of the pay, or can we do that, or are we locked into 71% of what we're paying?
Healthcare reform does define for us how much we can reduce in terms of contribution, and I believe it's capped at 5%. I may be misquoting that.
5% that we can reduce.
Right.
Okay, so that wouldn't cover the 60% increase. So
Otherwise, you lose your grandfathered status, and it's beneficial to us to hold on to that for as long as we can, because once it becomes a non-grandfather plan, then we have to put additional benefits in, which will have financial impact.
Well, what I was getting at, I mean, if somebody's, so dead set that they wanted that and were willing to pay the difference, and the county didn't have to pay the difference, I could see leaving it there, but with us locked into that, okay, that answered my question, so.
I'm going to recognize Mr. Sandvig to see if he had something to say from the school's point of view.
Well, and just from before Ms. Stinson came here, in the discussions we had before that, we've known option 1 was probably headed out because of the trends we've been seeing for several years.
Right.
And that at some point, the number of participants would just get so small that we would need to end it. Have them go to that option.
Any further discussion relative to the motion? Call the roll, please.
Commissioner Bond?
Yes.
Commissioner Jernigan?
Yeah.
Commissioner Jordan?
Yes.
Commissioner P?
Yes.
Commissioner Stanley?
Aye.
Commissioner Schaefer?
Yes.
Commissioner Ely?
Yes. Mrs. Stinson, the next proposal is to remove the copay for preventative medication.
I'd met with Cigna in October to look at our experience for prior fiscal year. And what it showed is that within our population, we have high current of chronic conditions. And the current of the chronic conditions inside of our population drives 62.3% of our experience. and that resulted in, 62.3% of the $38+ million that we spent through the medical plan with Cigna during that fiscal year. Hypertension and diabetes were the most prevalent of the chronic conditions. One of the things that we've identified as well is that we have over 3,600 gaps in care within our population. Gaps in care are determined when you look at labs, you look at medical experience, and you look at pharmaceuticals. So as an example, someone with diabetes who doesn't get their glaucoma testing as recommended within the annual period would show up as a gap in care. Someone who's on a hypertension medication that is getting refills at 45 days instead of 30 days tells us that there's a gap in care because they're either skipping doses or splitting pills, but they're not taking the medication as prescribed. All of those types of instances leads up to more cost inside of our health plan because conditions become exacerbated above where they need to be if they were properly managed, and that draws dollars inside of the plan. We know that our population is looking for the most cost-effective way to obtain prescriptions, and the reason we know that is because we had a high utilization of our on-site clinics as the purpose of walk-in pharmacies. We discovered that whenever we transitioned to the new vendor, and we were regularly receiving patients who would come in who were under medical management elsewhere in the community, and they were really just there to get refills on their prescriptions. So we sent out educational pieces about that through email, about what is the intentions of the clinic, and we are still having encounters of individuals coming in saying, I'm here to get my refills. I don't need you to treat my chronic condition, but I just need you to give me these drugs because that's what Dr. So-and-so wants me on. There is a concern that as we are redirecting those individuals back to the retail pharmacies, which is the appropriate thing to do because we don't want to incur labor costs associated with refilling medications, plus we don't have pharmacy edits because we are not a retail pharmacy, and other safety precautions in place, there is a concern that they will either not take the medication or they will start splitting drugs, and in either way they become non-compliant. They're going to drive other costs inside the plan. So I asked Cigna to take the list of what prescriptions, medications we have in the clinics, tell me if it's possible for us to convert these medications to a zero out-of-pocket at retail or mail. And they actually came back and said we already have a program like that. It's called Preventative Generic Drugs. And in healthcare reform for non-grandfathered plans, they have to offer these medications as a preventative drug. And that's why Cigna already has this program in place. They did a comparison of this list to what medications we provide in the pharmacy, in the clinics. They said that all the drug classes were covered in their list, and in some instances, the drug class was expanded. So we may have a few hypertension medications in our clinics, and the entire drug class would be on theirs, so that's actually better for employees. I think that we have to do what we can. We already know, based on the number of HRAs that we see in the clinics, the results that I saw in the Cigna file that said that we aren't getting proper screenings and things like that, that we have a certain segment of our population that doesn't take good care of themselves. And where we can, I want to remove the financial limitations that they may have so that they can get proper care and treatment. This is one of those categories that I think that it would be in our interest to make this generic drug list available to employees through retail or mail at zero out-of-pocket, so that we can obtain better compliance on these conditions that are costing us a lot inside of our medical plan.
Well, have you, just out of curiosity, we've got certain doctors that are on our list that people use here locally. Can you also send this list to those physicians?
What would probably be possible is for me to obtain, say, the top 25 and send this list to them. I don't know if I could send it to everyone, but I have, through my prior experience in working in a TPA, done outreach like that when the employer would put programs like this in place, and I could see if that was possible. I'd be glad to whatever degree we can to do that.
I'm just trying to think of a way that we could get this out quickly.
Right. The one thing that I would do, the earliest we can make this effective would be January 1, because it takes time to get Cigna systems set up. I would send this list to all employees, much like I did with when Lipitor went generic, I sent out a notice to all employees saying, if you're on Lipitor, the generic is now on the market, it may reduce your out-of-pocket costs. And I would send this out to all employees as well and encourage them during their next doctor's visit to take this list with them. So we could kind of look at it from two different perspectives on how to address it.
Well, right now, your Lipitor is cheap as the dickens because they're trying to get rid of it because of the generic that's hitting the market.
Right.
What's our cost?
Or cost.
I mean, it's no cost to us. This is just,
There's no administration cost, just the cost of the medication itself. And then we would reduce, right now on a lot of these drugs, we have a $4 copay. And so we would no longer collect that $4 or any applicable deductible. But we would gain in terms of better compliance, and then we would stop the labor costs that we're incurring in the clinics to do the one-on-one education with people.
Here's the question. If you get a prescription from your regular doctor, and then, that's for 6 months or so, but you don't want to go back and pay the $100 or whatever it is to him, you can still go to a clinic and get the nurse practitioner or whoever's there to write a new prescription out for a while longer. No?
No, if you're under medical
You can do that.
management elsewhere, then they will refer you back to that.
So
That
why would
physician.
people then, I'm talking about on these things here for diabetes or blood pressure or something.
Mhm.
So what I hear then you're saying is it's gonna wind up costing more to the employee if they have to go back to the doctor than if they go to the Take Care clinic and
If-
get the prescription refilled. Just, the paperwork so they can go and get it.
Well, theoretically, if they are an established patient with the provider, you should be able to call and say, I'm out of my whatever, and they will refill the medication.
I know what you're saying.
Right.
But
And if the doctor says no, then it probably means you're due a lab or something like that they need to monitor your reaction to the medication to make sure that you're still on the proper medication at the proper dosage and other treatments like that.
Been 4 years since your physical or something
Yeah.
like that. Yeah.
No, but a lot of these times, it's, okay. Well, I think you'll lose more people this.
Well, I was thinking, isn't that what you were saying though, is that that's not what our clinics were set up for, is to take those people that have been to their doctor 2 or 3 years and just give them medicine.
Right.
If that doctor's not managing their care.
Correct.
Seems like we would have more risk.
Right. Because we don't have pharmacies, we don't have retail or mail order pharmacy efficiencies, like I talked about the edits earlier. When you go into retail, you get a prescription filled, they can tell you if you're on 2 drugs that are on a counter interact with each other, because they have your history there if you always use the same pharmacy. When you go into our clinics, we are dependent upon you giving us an accurate list of what medications you're on at that current time, so that we can prescribe.
Well, I also know that if doctors are not full and you're looking for patients to come in, then that they want you to come back in 6 months or something like that, for medications you've been on for a while, and doing it so they can check you. So, in that case, just because you call them doesn't mean that they automatically send it. I know too many cases when I'm just pointing this out. I think.
But there are any number of medications that require follow-up to
Yeah.
check to see how it's
I don't
affecting
think-
other parts of your body, your organs, et cetera. I mean, it's some difficult
think-
medications out there.
I don't think we need to get in that bid, so.
This is just making it easier for them to get the prescriptions filled. This isn't a huge change. This is just doing away with the copay so they can get the prescriptions filled easier and not have to pay the $4, so.
Right, and it's actually.
Everything else still in place.
It's a gift to the employees, because if, repeatedly, both of the old vendor and the new vendor, you hear, I can't get an appointment, I can't get an appointment, I can't get an appointment. We had over 12,000 people, like I shared with you all last time, trying to utilize an average of 140 hours of clinic time a week. So what happens is, if their true intent is to save the $4 on copay, and they want to come in and have one of our physicians, intermittently manage their health care, then during the time that they're waiting to get in to be seen to save $4, they could be exacerbating their condition, which could land them in the emergency room because the pressure spikes or something like that, which is going to cost the plan more, which is going to be reflected in premium.
Gentlemen, we do need a motion.
I'll make a motion to approve.
Second.
Commissioner P. Made a motion, seconded by Commissioner Sandlin. Discussion or questions for Mrs. Stinson? Excuse me. Call the roll, please.
Commissioner Bond?
Yes.
Commissioner Journeyman?
Yes.
Commissioner Jordan?
Yes.
Commissioner P?
Yes.
Commissioner Sandlin?
Aye.
Commissioner Schaefer?
Yes.
Commissioner Ely?
Yes.
Be sure to take a cookie or some good stand there with you now.
It's okay, I'll leave them all for you. I'll just be here longer than me. Thank you.
Gentlemen, if you will turn, please, to Section 3 in your notebooks. We will begin with the general fund budget amendments. Mrs. Lester from the Election Commission has a budget amendment. Good evening.
Good evening. What you have before you is an amendment to our line item regarding postage expenses, and under the line item that's titled Printing, Stationery, and Forms. The reason for this amendment is partially it's really all due to the whole reapportionment process, and due to the fact that it was omitted from the original budget that was presented to the election commissioners back in January, February, March, when they were studying the budget for the upcoming fiscal year. With reapportionment, due to our county not having any countywide offices on the ballot until August that run by zones, we actually will not be using the new county commission districts and so on until the August ballot. That'll be the first time you see those. However, early voting starts 20 days prior to the August 2nd election, and the voters will need to know what their new precincts are, what their new districts, their polling places, and so on, well enough in advance. So we're planning to hopefully mail out these cards sometime in May or possibly early June, but we want to make sure that we have a large enough window of time for 145, 150, 160,000 people, however many we have at the time, to receive those cards. We do expect that we probably will get some, returned back to us in the mail, and we want to account for those issues as well. The cards that we will need to print their names and information on also have to be printed, and I have checked with about 5 or 6, 7 different printers, both locally and in the Nashville area, and the least expensive printer I could go with to get the cards printed is going to be at a cost of about $9,500, somewhere between $9,000 and $9,500 to get these cards printed. So that is the reason for the 2 budget amendments that I'm requesting this evening. Do you have any questions?
I just have one, Ms. Nicole. On those printing, do you need the whole 20,000? You haven't spent hardly any of the initial 10,000 that we had budgeted. Are you going to be spending the full 20?
Right. That's a really good question. We do have other forms and things that we will be printing, and we're just now getting really geared up for the election cycle to begin. Of course, we're less than 90 days out from the March 6th presidential preference primary, and we will be spending more. We haven't spent very much, but we haven't been in the throes of the election cycle yet either. So now that we're gearing up to get in the throes of the election cycle for 2012, we will be using more money from that line item. I hesitate to say how much we will use, but whatever we don't use from that, we plan to roll into the next fiscal year, because that'll be, the fiscal year ends in the middle of our election cycle next year. So that is this 10,000 will definitely cover the cards, which was not budgeted for initially. That cost was not budgeted for.
We just usually ask any department head to find what they can in their own budget.
Right.
And we're not finding anything in your budget
Right.
out of this 81,000. And then if you have to take from this hand, one hand to feed the other, if you run a little short in your stationery and forms printing in April or May or June, we could always backfill at that point in time. We always try and be, at least I do, and can't speak for, be very guarded with the unassigned fund balance instead of just coming here and take the full chunk right there. I mean,
I
it's
understand.
just, because it's hard to get it back sometime once we give it away.
I understand. I truly do, and I wish that there was a better way. Certainly, I didn't start my job until May the 16th, and the budget was, long had been approved by that point. There was just a lot going on in the office at the time the budget was initially prepared and submitted to the election commissioners. So I think it was just simply overlooked.
I understood you say that you had talked to people locally and then you talked to Nashville as far as getting people to give you bids. Have we formally sent this through a bid process? Would that help us or
No.
perhaps save us some money?
No, I've got them down. I mean, the last cards that were purchased, there were 15,000 cards purchased, I believe, by Mr. Walker in January. And those were purchased at a cost of about $1,300, if my memory serves me correctly. And it's just under 10 cents a card, and I've got them down to 4.5 cents a card.
Sounds like I like your way of thinking there, so thank you.
If that makes it easier
Buy a new
to
car, get her to
understand.
go with you.
Well, I didn't know if it would
Negotiate.
help you if some of these, we put out a formal bid request through purchasing, if that would be an aid to you, or if we could do that now. If we haven't,
Well, it depends on how many dollars she
It's
has.
less than 10,000, but
So she gets 3 bids anyway,
I'm a-
written if it's 5 to 10.
I'm a
Right.
very conscientious shopper.
Well, it sounded like that from what you were telling me. That's I was just trying to think of something that might help you out along that way. So.
Right. My first quote was from our existing printer, and they are in Nashville. And then I got some other quotes from several local printers here in Murfreesboro. I'd like to keep it local if we could.
Yeah.
So, that one of those came in right at or just slightly below what our current printer had quoted. So
So you agree with the unassigned fund balance? Madam Chairman, make a motion that we approve.
Sir.
I just hope we have everything worked out on the redistricting by then, so we can send our cards out appropriately.
A big question mark where you
Big question mark by then.
Any further discussion? Call the roll, please.
Commissioner Baum,
Yes.
Commissioner Jernigan,
Yes.
Commissioner Jordan,
Yes.
Commissioner P,
Yes.
Commissioner Sandlin,
Aye.
Commissioner Schaefer,
Yes.
Commissioner Ely.
Yes. Thank you.
thank you all.
Thanks.
Okay, our next budget amendment is from the Correctional Work Center. Mrs. Noble.
This is a request to move $4,500 from other contracted service to maintenance agreements to be able to cover some of their kitchen equipment.
So moved, Madam Chairman.
Thank you, Commissioner Sandlin. Seconded by Commissioner Jernigan. Discussion?
It's not near as hard when it's within your budgetary line items. That's what we was talking about.
Call the roll, please.
Commissioner Baum,
Yes.
Commissioner Jernigan,
Yes.
Commissioner Jordan,
Yes.
Commissioner P,
Yes.
Commissioner Sandlin,
Aye.
Commissioner Schaefer,
Yes.
Commissioner Ely.
Yes. Information technology. Mr. Robertson and Mr. Harris, right?
Lee Harris, yes ma'am, that's correct. Lee and his staff comprise our communications division, and they're responsible for putting all of these programs on television. Lee is often on the other side of the camera.
Getting our good side.
Yeah. We have a budget amendment here that comes partly from the steering committee and partly from needs that have developed during the year. All of these items pertain to the county commission and the televising of our county commission meetings and the quality of our meetings. One item that you don't actually see on this amendment list are 10 iPads, which we think we can sustain in our regular operating budget in our data processing equipment line item. So steering suggested that we proceed with purchasing 10 iPads, and begin the process of eliminating some of the paper that we use during our meetings, and so we are going to proceed with that.
How's that gonna work? I mean, you're gonna pick 10 commissioners to get an iPad and the other 11 don't?
Every time you go to a committee meeting, they're gonna be at your.
They're gonna be handed out at the committee meetings.
Just gonna start with the committee meeting.
But not at the full commission,
Not
because there's
yet.
21.
We'll get there,
Yeah.
hopefully.
They'll be staged
School
and ready.
board's been doing that, in other words.
They use
School boards
laptops.
use
School board.
laptops for several years. Mhm. But the iPads will be stationed here, ready for you prior to the meeting, and all the materials.
Instead of all the books, right?
Yes, sir. And you will receive all the materials prior to the meeting, and could have reviewed those and/or printed them on your home computers, and then they'll be here available. And we're just gonna take this slow and take it one committee at a time. Maybe start with a committee that has lesser paperwork than budget committee, and just add committees as we go along. We'll provide training before meetings and just pick them up at a leisurely pace. Is my thought process.
Would it be live, or the general public could follow this online? Do they look at what we're looking at, or would that be, or not?
Well, the document clearinghouse, where they will be posted prior to, the pre-meeting materials, would be just as available to the public as it is county commissioners.
Right.
It'll be just like our redistricting process, Commissioner Jordan, where we post the documents up and interested citizens could actually subscribe to a particular committee and be notified the moment any materials are posted to that site. So the pre-meeting and post-meeting materials will all exist out on a website, and the media or citizens and the commissioners, we will impose upon all the commissioners on that committee a notification that they be notified of those meetings, so that we can be assured that they're receiving those materials, but others can elect to subscribe to those feeds or not.
Now, say the commissioner already has a smartphone or device. I see on here you've got email addresses. Are you talking about the current email addresses that we have here at the county, or are you talking about a personal account?
All right, that's a little bit.
Or if I jump something there?
Well, no, this is a little bit different aspect of what we're trying to do here with all of these improvements. Commissioner Gooch actually had suggested that we, instead of having commissioner comments arrive at your personal email addresses, and I'm reminded of the fact also that not all county commissioners provide us personal email addresses, and we're going through a fairly arduous manual process whereby we print those and put them in their mailbox, and there could be delay in them receiving those materials. Commissioner Gooch's concept and my hope and desire is that every single commissioner would then have would then have an official county email address, and that you would be able to check, and it would be assigned to you. Probably won't even have your name as the name of the email address. It would probably be, District 13 or what have you, and then that would become after an election, for instance, that would become a new, the next commissioner's email address that they would then be given credentials for. So a little bit separate of an issue. The notification email that would be kicked off whenever, like Ms. Short, for instance, posted budget minutes, would then go to your county commissioner email address and alert you that mail is present.
Clear up some public records type issues.
Yeah.
What's
Very well.
admissible to court proceedings and different
Everything
things
will all
like
be
that.
one and the
Yeah.
same.
Yeah.
The media gets it at the same time as commissioners and interested citizens.
Mhm.
Well, that's where I was headed to with the next question there, because our attorneys, have you talked to our attorneys about this and setting up an email address, these type things?
Not specifically about this. I think it's so. I think it's well known that it's not even questionable enough, I guess, Commissioner, for me to approach the county attorney with any. There's no question in my mind that this is all open records, and that we will, as we do, we will be converting from a situation where I cannot currently produce emails that you have personally received, and I cannot, under any court order, because it's not there, I can't do that. we will now be able to, much like we have done in court cases and per public information request, it should definitely be known to all commissioners that any and all email addresses sent to or from these official county addresses will absolutely be subject to any and all public record requests that might come down the pike, much like is true of all county employees currently. And I don't even think there's any question in that regard, but maybe there's something else we should talk to them about.
One thing in steering that alluding to what you were talking about is, during the meeting or something, we wouldn't send each other emails or something like that. What do you think? Or
Well, you could whisper
or whatever.
Yeah.
I mean, you could probably text them or call them now. But I mean, as far as with these iPods though, that we couldn't do that, nor do we want to. But I'm just saying, it would be a fail-safe in there as far as we wouldn't want that to happen. And stuff like that, as far as a legality or a sunshine law kind of thing or something that we didn't want to get in trouble for that. I think that's what you were asking about.
Exactly. I don't want to get into trouble with the sunshine law.
Right.
That's why I was wondering if you'd already ran this by our attorneys and make sure everything's kosher with that. I mean, before we vote on this at the full commission, I'd like for you to do
Well,
that.
I'm happy to. I think.
I mean, I don't think there's
No.
any problem there, and none of us
Yeah.
are trying to hide anything. We're just trying to get in the modern age here. But
I would be especially concerned about if we were doing anything other than all assuming that this is completely all public record. If we were trying to say that it shouldn't be, we definitely need to go to the county attorney's office and get a ruling, and he would cause us to become more conservative in that regard. I feel sure, but in this case, the safe thing to do is to assume that it's all public record.
Yeah.
well, I mean, I like the feeling that I've got a public email that people can send me something to, and other people can look at it and say, hey, well, this is above board and there's nothing going on. Whereas, right now I do have a private email, several of them, like probably most people do, but those aren't subject, I assume, to court order because it's personal. But then if somebody sends me something from the county pertaining to a commission meeting, perhaps it would be, and I'd be open up for that to be looked at. And personally, I like this better. It's open to the public, and, I don't care who looks at it. But
I've got a question that's a little bit along these lines. The current system, when we get a comment through the web page, is forwarded to the commissioners.
Yes, sir.
That is that public record?
Yes, sir.
It's noted on the bottom of each email.
Yeah.
Do not forward
Yes,
this
sir.
email without the express written consent of the originator or whatever.
That
And I
is-
actually forwarded one on to the mayor's office, and the guy called me on that and said, hey, it says on that, and I said, in my opinion, it's public record. It went through the public system and all. Could we not change that?
Unfortunately, that is a separate server.
Mm.
It's just a web comment when it's on the website. When it forwards it on to you, it starts to be handled by the mail server, and that's when that automatic disclaimer goes on there. That's there for pretty good cause for most county interactions and even possibly HIPAA things that we might encounter or what have you. Unfortunately, that's getting superseded by a different server that's handling the course of that request. In this case, I would imagine we might even eliminate the web comments or change the nature of them so that it really is, if you all have official email addresses, then there's no reason to provide that web comment, which in my mind has always just been kind of a professional looking mask, if you will, to prevent, Will Jordan at AOL.com from popping up on the county website. It just kind of at least professionalizes a little bit. So we might even be able to eliminate that or clean that up and prevent that from happening. That's a good point. That doesn't look appropriate.
Yeah.
Shall I proceed down
Please.
these? Okay. So that is really 1,270 of that 411 is for email. The remaining portion of that is for a courtroom projector repair. And Lee, if you would pick up here and describe these last three items.
Yeah, the single mount projector for 205 is just to put a We're gonna try to get a mounted projector in this ceiling right here instead of having that cart. I know a lot of meetings, we bring in that cart in there and that'll just eliminate the cart altogether. So, we'll put that in there. People can just come in, plug up the projector to the wall plate and not have to worry about the cart being in here the whole time. So that's that.
It's a little distracting, Lee, even hampers some of our camera angles. I know I was sitting here the other night and I watched it afterwards and you couldn't see my face half the time.
Exactly. And it takes up most of the space right here with that cart in there. So that would be that. Courtroom projector, I don't know if you're aware of it, but the projector in the courtroom hasn't worked for a couple months now. We've had to roll in a temporary projector for some of the planning commission meetings, BZA meetings, putting the stuff on it. This would repair a lamp and do some routine maintenance on it as far as cleaning it up and making sure everything's working good on it. Last one is a it's a new switcher gear. We have a mobile switcher that we take to the mezzanine over there, Planning Commission. It is one of the inputs has failed on it. It's almost approximately 4 years old now, and they do not service that model, and they do not make parts for it anymore, so it's unserviceable. So we can continue using it with 2 channels, but it won't be professional and won't be what we're used to having, or we can replace it with newer parts, switcher parts, to get it up to that standard again. And that's what that budget item is for. And also,
4 years old, don't make parts. It's just amazing the technology world. 4 years old, don't make parts for it.
Yeah.
My new truck is 4 years old. It's new, but
the television is constantly changing every year.
We had hoped to get through the balance of the year with that. I mean, it's why we didn't budget for it.
And yeah, and the other thing I was going to talk about, we're replacing. Well, we've got an older switcher that's almost 7 years old upstairs, and it's been giving problems on and off. And we've been using this mobile switcher as a backup when it goes down. So now our backup and mobile switcher is down. So if something goes wrong with what we have, we don't have anything. So
you should have seen his face when I asked him in steering about the longevity of the iPods. 10 years, and he went. I mean, in 6 months they're obsolete basically, or a year, and so I think your answer was, we hope to get 5 out of them.
Yes.
Well, you also said they were solid state and they should last 10 years easily. That's what I was going to ask.
Because for one thing I was saying is it's informational, so it's all download and upload stuff, so it should last for a long time.
Yes,
So.
sir.
There might be new technology comes out that's better,
Right,
faster, that kind of thing, but this stuff should last as far as electronics go.
Yes, and really won't benefit that much from technological advancements because you can only view a PDF so fast, and that's primarily what you all will be doing with them.
Well, that's why I haven't upgraded my computer. I can't think faster than it and run anyway. So.
Do please note that this is out of the mayor's $599 account. Otherwise, it would have been from undesignated fund balance.
Therefore, I make the motion to approve. Madam Chairman.
I'll second his motion.
Thank you, Commissioner Sandlin, seconded by Commissioner Petty.
Startup time now on these that we're thinking. I mean, January when what are you thinking?
It's possible. We will order them. We will go ahead and order the iPads. We already have the website set and ready to go. That's ready to go. So it's possible we could be ready in time for a January meeting, Commissioner.
Just checking.
It's quite possible.
we're not getting them here anyway. It's going to start at somewhere, a committee with less paper.
So they say.
We're the last, we'll be the last one.
Gentlemen, any further discussion relative to this motion? Call the roll, please.
Commissioner Baum?
Yes.
Commissioner Jernigan?
Yes.
Commissioner Jordan?
Yes.
Commissioner P?
Yes.
Commissioner Sandlin?
Aye.
Commissioner Schaefer?
Yes.
Commissioner Ely?
Yes. Gentlemen, thank you. Mr. Russell,
Be
from
sure
the
to get your cookies, guys. These real quick. That's good.
Mr. Russell, if you'll join us, please, with your...
Good evening, everybody.
budget amendments from the Sheriff's Department and Jail. I think you have 4. And the first one is sort of a replacing amendment we did, so you might just explain what we're doing there.
Was this one you emailed me this afternoon? Yeah.
The 24,000.
Okay. Okay, so the first one, you can start on this one first, the one you just handed me? Is that what they've got in their mouth? Okay.
Yep.
And so that does it, just read.
Oh, okay, all right, just want to make sure. All right, so this amendment replaces, I see what you're doing, okay, all right. Yeah, what we needed to do is we needed to move the funds where we gotten donated in for the canines into the confidential fund. So that's basically all this amendment is we're moving it out of the contributions line item on one into another, and then we're moving it again because it needs to go into the restricted.
Yeah, that first one
Yeah.
is just undoing the one we did
Undoing the one
last
we
time.
did, yeah.
And then
The
the
next
second
one
one
is
is the proper one.
putting it into the 121 fund and then putting it into the line number 319, which is where we'll actually pay for the canines out of.
That's the first one. Now, if you'll turn, gentlemen, we can get I think we have 4 all total. And if I do not hear otherwise, we'll take this as one vote.
So number 2 on your list, we'll drop down to number 2 where it says 54,210, 399 other contracts. We're going to pull $19,400 out of that line item and put it into the rentals line item. This is to cover some additional storage space that we've rented and for the horse barn. And so that's what that's for. And the monies there, this of course is Dr. Rudd's line item. The funds are there because we get funds back from the state for medical reimbursement, things of that nature. So. Then on the next item, under the donations line item, we have $11,578 that's come in, and we're going to put that into the 3 line items you see below it, and those are to cover donations that came in for our Memorial Garden, the Community Garden, Operation Integrity, and of course, Shop at the Sheriff program, which we had.
Can we go back up? I don't want
Yes,
to
sir.
be
That's okay.
too unconfidential, but
Yes.
what is that again?
Oh, the line 319?
Yes.
That's confidential. It's where they do drug buys and
Okay.
stuff that they, yeah.
Never
So,
mind, that's
yeah.
that. Okay, the rentals,
Yes, sir.
the 19.4, what's that again?
Okay, we have the NARC building that we have to pay for, and then we rent some space for all the stuff. We got 5 truckloads of stuff from the hospital was donated, of all kinds of desks, equipment, boy, I mean, just everything. We had to have some space to store that in the meantime, so we're renting space over at one of the buildings next to us.
Okay.
And then we also have, of course, the horse barn that we're renting, and so that's what that's for.
So is this an ongoing rental thing here for that, or y'all gonna
Well,
kinda get that?
eventually the S&P part will drop out for where because we're using up all the equipment that we got donated. We're moving it into the building as we get it cleaned up. Some of it need little repairs here and there and stuff like that. We got tons of notebook computers and just, there's all kinds of shelving and everything else. We cleaned up what we could and used it. One of the desks that came from there's in my office, and then right outside, everybody's jealous, right outside my door, but it gets used as one of those ice machines. You know, you go to the hospital, it's got the little ice everybody loves to have. You know, everybody loves to drink, and so that thing is it works like a clock all day long. There's somebody always standing at that thing. So we got a couple of those donated. So that's where all this equipment's been stored while we clean it up, because some of it's just been sitting for forever or needed little repairs here and there. And so we cleaned it up. Used a lot of it, but we're almost done with that, but there's still a little bit of space being used right now.
And you should have one more. Number 4.
Oh.
Sell of materials.
Oh, I didn't have that one, okay. Well, yeah, sell materials, that is where we have sold T-shirts and our coins and our bricks and everything for Memorial Garden. For the 9/11 memorial that we've got over there, and so we're just recognizing those supplies, and we want to get those and those other line items so we can then pay the vendors for those. And that's all I got for tonight.
I'm gonna make a motion to approve. Like I said, we've seen this in public safety, went over it pretty thoroughly. Asked some of the same questions Steve did about the rentals, so.
Thanks, Commissioner Figg.
Second.
And seconded by Commissioner Jernigan. Any further
I
discussion?
hadn't seen the playback, buddy.
Call the roll, please.
Commissioner Baum,
Yes.
Commissioner Jernigan,
Yeah.
Commissioner Jordan,
Yes.
Commissioner P,
Yes.
Commissioner Stanley,
Aye.
Commissioner Schaefer,
Yes.
Commissioner Ewing.
Yes. The DEA Special Purpose Fund Budget Amendments, Mrs. Nolan and Mr. Russell, are you going to tag team on this one?
I'll do this one.
You can do that one, okay.
This is changing to the new definitions of fund balance, and in talking with the auditors, we had labeled that as a sign for public safety when the monies coming in are from these forfeited funds, and it is restricted for public safety. So that's what we're doing, is changing it from assigned for public safety to restricted for public safety. $204,130.
So moved, Madam Chairman.
Second.
Commissioner Sandlin, Commissioner Sheffield. All in favor, please say aye.
Aye.
Opposed? Thank you, that motion carries. Mr. Russell, is that everything?
Right. Is that that?
Yours.
Okay.
He's got everything.
So then the DEA fund, account number 121.
Oh, yeah.
In November, we had $1,137.60 come in, and so we're going to, that was our revenue item, and we want to appropriate that into our 196 in-service line item for the DEA line. So big amount.
Commissioner Sandlin,
Second.
seconded by Commissioner Jordan. Call the roll, please.
Commissioner Baum?
Yes.
Commissioner Jernigan?
Yes.
Commissioner Jordan?
Yes.
Commissioner P?
Yes.
Commissioner Stanley?
Aye.
Commissioner Schaefer?
Yes.
Commissioner Ely?
Yes.
And I would like to just quickly comment, I mean, this kind of shows you the variance that you get, because on the last month it was 275,000. So, you know, we have a good month, and then we have a bad month, a good month, and so it just kind of depends on what comes in, so.
One thing before you jump up and run, and this is kind of from public safety there too, on the rentals that you've got, would you mind bringing us a list of public safety of the cost of all our rentals? You know,
Yes.
just group them
Yes.
together, I mean, you can
For
separate
just
them if
property
it makes
rentals
sense.
or for anything?
Well, for anything, because, you know, just looking at the price of some of these rentals that I've seen,
Yeah.
you know, it might be cheaper on us to buy property and build a building.
I understand.
And I want to look at it from that aspect too.
Okay,
so.
I understand. I'll do that.
These rentals are getting up there.
Oh, yeah. Well, we definitely could use the space, because we're accommodating everything we can. You know, like I've said several times, you know, I think we've built out everything that we can in that building, so it's just pretty entertaining to see a little spot somewhere, and we go over and put a couple walls in, and next thing you know, there's an office there. So you never know. That's all I've got.
Thank you.
Okay.
Get your cookie.
Okay, thank you very much. Are these gingerbread?
Gingerbread.
Yeah.
Cool.
Gentlemen, turn to section 9 in your notebooks, please.
Do you want gingerbread?
And this is the annual contract in lieu of performance bond for the landfill, and this is our annual inflation adjustment, and it has been decreased this year. You will see at the bottom of the page, the amount is $3,368,578.
Move to approve.
Thank you, Commissioner Jernigan.
Second.
Seconded by Commissioner Jordan.
This rate will be out in 300 years.
All in favor, please say aye.
Aye.
Opposed?
A little over $100,000.
Thank you, that motion carries. I will ask our guests to join us at the table. Karen Neal, who is with Bass, Berry and Sims, and Sam Cruz from our longtime financial advisors, the Stevens Group. They will be here to assist us with several items on our agenda tonight. Gentlemen, in section 9, we will begin with the federal tax compliance policy and procedures. Mrs. Nolan, I'll start
I
with
would
you.
say that you remember that we did our debt policy about 2 months ago, and because of some IRS issues, requirements, we're now bringing forth the federal tax compliance policies and procedures. Karen, kind of take it from there.
Well, as you know, the county issues debt that is exempt from, the interest on which is exempt from federal income taxes. And along with that comes a number of, as you would expect, pretty complicated federal tax laws and rules and regulations that the county needs to comply with and does comply with in order to keep the bonds tax exempt and have the benefit of that much lower interest rate that you get when you issue tax-exempt debt. And over the years, we have been able to really provide evidence of that through the commitment to do it through the bond resolution that the commission adopts that has a covenant in it that says that the county will do everything that is necessary to keep the bonds tax exempt, both from the time it's issued through the life of the bond issue. And we also have the county officials sign a federal tax certificate that really acts as a roadmap for the not only the issuance of the bonds, but tracking the investment of the proceeds from the bonds over time, the use of the facilities, and a number of other things that are necessary in order to make sure that over the life of the bonds they remain tax exempt. The federal government through the IRS has also required since 1986 that this form called an 8038G, which is an informational reporting form, be filed with the federal government each time you do an issue of tax-exempt bonds. This form, when I started, was about half a page. You know, like most federal forms, it's now 3 times as long. It was a page and a half. And, of course, the rules and regulations have become even more complicated over that time period as well. We learned in mid-October through the Internal Revenue Service's website that this new 8038G had been proposed and that there are a number of new questions that the county must respond to when the debt is issued in using this new Form 8038G. And one of those questions is whether the county has written policies and procedures that govern both the issuance of the debt and then tracking the investment of the proceeds, the use of property over time, the education of the staff that is responsible for monitoring all of these things. And in the past, we have basically, as national practice, relied on the federal tax certificate and the covenants in the resolution for providing that. But the IRS, at the same time that it issued this new 8038G, said that the federal tax certificate is, while is written and it is a roadmap for that particular issue of debt, is not sufficient as a generic sort of tax policy and procedures. So as a consequence, we drafted the federal tax compliance policies and procedures that are attached to the recommending resolution in the package there, and it basically really just reduces to writing the things that the finance director and her staff have been doing in an exemplary fashion over time anyway, and sets out the different sort of procedures for tracking expenditure of proceeds, as well as tracking the use of the property finance to make sure that it remains as a public use, the investment of the proceeds of the bonds, and as a result of that also tracking rebate that might be due the federal government, maintaining records, which is very, very important with tax-exempt bonds, and also various other miscellaneous provisions that relate to tracking all of this information and making sure that the projects remain public. As I said earlier, this 8038G form, which I'll just pass around in case you haven't seen one, has a couple of boxes on there that ask whether you have these written policies and procedures. If you don't, the IRS has said that is something that they will consider when they determine their candidates for random audits. And that is, while that's a process that can be very time-consuming and that you would likely want to avoid if possible, this would be something that would perhaps tell the service that you are doing the things that they are expecting you to do with respect to adoption of these policies. So I'll be glad to answer any questions about that.
So all these come under your umbrella as far as management, so to speak?
Our role is to act as the county's bond counsel, so we're your law firm, and we provide a federal, we provide an opinion that the bonds, when issued, are exempt from federal income tax. And we base that opinion based on a number of certifications that we get from the county, discussions with Lisa and the mayor and others about how the proceeds are going to be used over time, and working with Sam and his group at Stevens. And so what this does is essentially it names, in order to provide consistency over time, it names the finance director as an official who is responsible for making sure that all of these things happen.
Well,
And
like
it-
I'm saying, the different portions of it, like in two, enter into a management service, incentive payments and stuff, you're gonna take care of that. Enter into a lease with a non-governmental person, you're doing that. Sell or otherwise transfer the property. There's not additional fees to each and every segment of this. There's just there's a.
No, I think it says that we won't do
That's
these
just a
things.
list of things we won't do right there.
We
Right.
won't do these things unless we have talked to them.
Yes, but they're in charge of that, though, so to speak.
They're just our counsel.
They're just our counsel.
Just strictly
Advice.
counsel and advice. Okay.
Right,
Gives you
and-
advice to do to stay tax exempt, and if you don't follow her advice, then you might not be tax exempt.
Yeah. Okay.
That's much more succinct and elegant.
It's gonna pay a lawyer to do it to tell you.
Right, right.
And bottom line, the last section is Lisa is responsible. So
That's
Well, and the advice that comes from them comes through you, which comes to us
Right.
in turn to, as far as, okay, what do you want to do about this situation?
Right, and we
Yeah.
work very closely together, and there are issues that come up over time, and Lisa picks up the phone, and we talk about it and work through it and come up with a solution for handling each of those situations.
What does it cost us in a per telephone call, kind of, you know what I'm saying? There's an adjustment each time we notify you about an issue, right? Or is it's
We pay them.
it's inclusive?
We pay them when we do a deal, when we do like this bond deal.
Okay,
They do not send us bills on the interim calls that I make.
okay.
Right.
Other attorneys do, that's why I'm asking. You know, I mean,
Well, because we have our opinion on the bonds that
Yes.
says that they're tax exempt, that we really view it as preventative in thinking about your insurance consultant who was here before. And if we can work through those issues so that it doesn't become a problem ahead of time, that's much better for everybody involved.
absolutely, totally agree with you, and I'm all with you. I'm just asking the in-between here and here, whenever our finance director has a question or a problem, you know, and she picks up the phone, or we need your advice, or we need you to tackle this issue, whatever, then you're there with us all the way through as a one,
She's available.
She's very available.
yes, instead of a question by question, fee by fee, is what I'm, I guess, asking.
Sure. Well, we charge a fee for, at the time the bonds are issued,
Up
for
front.
giving our opinion and
One
preparing
time.
the documentation, a one-time fee.
Yes.
And then after that, we certainly are available and encourage questions anytime there's an issue that comes up. If there was something that was of substance that was going to require the investment of a large amount of time, then that would be a separate matter, and we would talk with the county and its officials about negotiating a fee for undertaking something that was of a larger consequence. But just picking up the phone and talking about a particular investment or the use of a building or a lease by a daycare, some portion of a school building, are things that we consider it part of our responsibility and really encourage those phone calls because it saves us all a lot of time in the long run.
Sure.
But that's another question.
Thank you.
That's the way we handle it. And if there were to be an audit, then, and you wanted to engage us to assist you with that audit, then that would be a separate engagement as well.
And we have one of those each year too on
No, this is
each.
different. This is a different audit.
Different audit
Okay,
completely.
okay.
You don't want the other kind of.
Yeah.
It would be akin to if you were to have
We
an
like
audit of your
preventive
personal
audits, yeah.
income
Yeah.
tax.
Yeah.
Occasionally, the IRS has really stepped up its audit program, and it's a pretty robust random audit program now. So when I first started practicing 30 years or so ago, it was very rare to see an audit of tax-exempt bond issues. But in the last year, it has become, well, last 2 or 3 years, it's become something that is really not rare and something that we've seen with some frequency. So it's more and more important to really make sure that you keep good records, that you are compliant with the IRS's rules and regulations. Your staff does just a terrific job of that, and this, as I said, these policies really just reduce to writing what they're already doing, because what they do is fully compliant with the federal tax laws.
Thank you.
And we have had one audit
Yeah.
of one issue.
Yes.
So is this just for information, or are you looking for us to
We'll
adopt this?
adopt it, and we'll be having a resolution on
Make a
it.
motion to adopt it.
Second.
Thank you, gentlemen. Any discussion or questions for Ms. Neal?
I'm just wondering if the finance director has to sign this in her blood.
I hope not. I think that's a bullet point.
Any further discussion? Call the roll, please.
Commissioner Bond?
Yes.
Commissioner Jernigan?
Yes.
Commissioner Jordan?
Yes.
Commissioner P?
Yes.
Commissioner Sandlin?
Aye.
Commissioner Schaefer?
Yes.
Commissioner Ely?
Yes. Gentlemen, turn to Section 8 in your notebooks, please. And we have a resolution authorizing the issuance of general obligation bonds in a principal amount not to exceed $21 million. And I will ask Mr. Cruz to, first of all, give us a brief history of this, as it started as a capital outlay note, and then give us some information of what action we need to take tonight.
Okay, thank you. This particular financing actually started 3 years ago. Time flies. Back in 2009, and really in 2008 as well, there was some interest to take advantage of the lower short-term interest rates. So you were actually doing a bond issue, I think it was part of an $85 million school plan implement. And some of it was done as long-term fixed, and 21 million of it was carved out to be short-term, to get that lower rate. And you did get a lower rate. It was, I think, 1.94 was the offering yield on those bonds. And if you had done long-term fixed at that time, it would have been well over, I think it would have been over 4, I know it would have been around 4 to a little over 4%. So you were saving a couple of percentage points. And the decision was made at that time to lock in those short rates for a period of 3 years. So you have saved a couple $100,000 a year for 3 years by doing that. So that's the first bit of good news. So here we are now. 3 years are approaching, and the note is coming due. And the note was never meant to be permanent financing. Obviously, it was a long-term project, and it was a 3-year note. So, but it was designed to give you some flexibility, so that when 3 years came, you could make a decision what to do. So some things have happened and changed over the last 3 years. Number one, long-term rates are lower than they were, which is more good news. They're between 0.5 and 0.75% lower than they were at that time. Secondly, it's my opinion that the perceived risk of these kind of issues has grown over the last. There's a few different things, but I mean, you do have with this type of note a bullet of 20-some million that comes due on a day. So you have to arrange your financing beforehand. And I think in the world there's just more sensitivity of, well, what happens if you can't get your financing, in anticipation of this. And then things like the United States government has been downgraded. There's talk in Washington about changing the tax law treatment to buyers of tax-free bonds, which if you've already issued long-term fixed, it doesn't matter, but if you're going to do it in the future, it could matter. And then additionally, you're getting ready to do a $50 million long-term fixed issue anyway. So I think in consultations with Lisa and the mayor, the thought was it might be prudent to go ahead and lock in the savings you've already achieved, locked in the savings from lower long-term rates, and just refinance this 3-year note with the new 20-year issue that you're about to do. Just put them together, sell them probably in January, and it will become basically long-term locked-in money probably in the 3.5% range.
That does vary us from our standard 20 years, because this will become 23-year money.
It
at that point in
would.
time.
Except it's two
Because
different ones.
instead of going with 17 years at this point on this 21.
Yeah,
I don't like stretching out any more than we have to.
Well, and I
There
do-
goes your savings.
I do recall
Yeah.
there was some discussion at the time about whether to do 20 or 25, actually.
Well,
Back-
not for me, it was.
That's right. No, perhaps not.
There was discussion, but it
Yeah.
didn't go very far, so.
Yeah.
Count up the
So,
extra millions of dollars in interest, it didn't go very far.
yeah, so basically, I think legally what you're doing is you're converting your notes into bonds, is what's happening. And I do think, the perception will definitely be that you're improving your risk profile by doing that. And, clearly, the assumption in this resolution is it would be amortized on the same schedule as the other bonds, but, these decisions are, of course, up to you.
Carl, on today's market, what are ballpark counties borrowing money for in our situation? Are we looking at mid to upper threes?
I think mid to low, I would throw out like 3.5% as a number today. We just did a deal for Ray County, which has a lower credit rating, and it was like a 3.8%, 33 million. So you would be better than that. Now, it's a volatile time in the world, and so
We're still 6 weeks away from that, I would guess, or something, are we not?
right now.
Time you go to market now,
Yeah.
things can change between
Yeah.
now and then.
Your audit should be, I guess, final soon, very soon. And at that point in time, we can sort of send the final audit to the rating agencies, and hopefully, it's hard to sell, it's tricky to sell bonds Christmas week or the week after Christmas even. So that throws us into January. And I will say that originally the thought was not necessarily to couple these, because we were thinking we might have done your $50 million issue a little earlier. But now we're so close that it makes some sense. And these notes, to do what we're doing, we have to be within 90 days of the maturity date of the notes. So we could not have done this conversion in a good way for you anyway, prior to January 1. So.
What is the short-term rate running now?
Well, it's a more complicated question than you would think. The rate itself, and if we say short-term, the traditional short-term market, and we talked about this a few years ago, is where your bonds are almost sold every week, and there's a bank that backstops it, so that if it's a bad sale and people want their money back, the number of banks that are even capable, of providing that service is diminished, and the ones that do are now charging, anywhere from, probably you're lucky to get 0.5%, maybe it might be even 1%. So you have to add those fees onto the rate. So if you were doing like a 2 or 3 year note like this, to the extent the market still was receptive, I mean, it would be in the mid-ones. You could do a 2-year type deal in the mid-ones, or you could do, possibly some kind of indexed-based loan with a bank. But the question really is if you can lock into the 20-year money at the 3.5 type number. Should we not go ahead in this environment and reduce our risk profile? Because again, I think the original plan was always at some point to probably fix it.
Are we paying principal this time, or are we just paying interest?
Just interest.
So we're not paying anything off. We're veering farther away from our, as
that-
I alluded to
that
a minute
we
ago,
did
the
not.
20 year.
Well, on this,
Yeah.
Yeah.
So if we kept doing a 3-year thing, we're not getting any principal out of the way.
You did on now see, this is the first anniversary of this note. Now, in 2008, we did another one, and it was a $10 million note. When it came due, you paid $400,000 down on it, as I recall. So now it's and it did roll, and it's at 1.65%, and so you stuck to plan. Here, the difference is, this is the first anniversary, and this is where you would decide.
Well, too, you kind of concerned me when you said there are new tax law proposals that may be detrimental to the short term. Is that, you mind elaborating a little bit there? Or?
Well, I think it's coming more from the White House, and it's the idea that, and you've probably heard a lot about tax reform, and what they'd like to do in some instances is reduce the deductions that people with higher incomes can take. So if you have an income that they view as a higher income, and you've historically been able to, not pay taxes on your municipal bond interest, they'll say, well, if your income's above a certain amount, then you can't take that deduction.
Okay.
So and that's not gone into law, but, we get these little press releases, periodically, and it's just been in the bullseye of a lot of interests that they're trying to find money, and they're trying to target wealthier people.
It's because Warren Buffett said he was paying less taxes than his secretary, and where that came from.
That could be part of it. So, though, were they to do that, and I mean, the headline would be, well, your interest is still tax exempt, but it wouldn't necessarily be tax exempt to the people who often buy your bonds. It'd be tax exempt to lower income people who don't often buy your bonds. So that's the kind of dialogue that's going on. And and when people talk about a flat tax, that's another example where they're sort of saying, well, everybody just pays, X percent. None of this, tax-free interest or tax deductions or tax credits. So that risk, I mean, again, when you're running $1 trillion deficit, sooner or later they are going to do some things, and we don't know what they're going to do.
Thank you.
Any other information that we need before we consider this resolution?
I'll just say that this resolution has a lot more information and more attachments than normal, primarily due to our...
As a result of our debt policy now.
More disclosure.
So do we need a motion?
Yes, we do.
Approve this $21 million be rolled into, with this next bond issue and at a fixed rate. I'll make it.
20 years, I guess that's given, isn't it?
Second.
Okay, we do have a motion and a second. Discussion.
What does it do to, what is right in the middle of this with the city of Murfreesboro being on that first?
If you remember, Eagleville is, no, wait a minute, no, this would have to do with that original, when we borrowed the money.
Yes.
This resolution refers to that issue of September 11, 2008. And at that point, when we borrowed for projects that would have had some elementary component that we would have had to share with the city of Murfreesboro.
They've already got their check.
That's what I was thinking.
Yeah.
This is a description of what the original note money was used for.
Yeah.
Any further discussion?
It still comes back before us before we actually go, correct? As far as whatever that is, if not, it doesn't. I mean, unless we sit in on the.
Yes, we issue bonds on the date that they determine.
Well, we got $21 million already spent. We've either got to do it short-term or long-term. We can't.
It's not new money.
Yeah, it's not new money.
It's refinancing.
Oh, I understand that. I just, as far as the rate itself, we actually won't know that until
we take the bids that particular day.
Yeah. And so we're looking at the first, second week then in January, third, somewhere.
Probably the second week, second or third, but it will be, that is something that, with the competitive sale, there's a little bit of, you set a date, at least a week in advance, and you can pull it if the world's turning upside down. But probably right after the first of the year, based on market conditions, we'll determine which week to have the sale, and then it's a competitive process.
Gentlemen, any further discussion? Call the roll, please.
Commissioner Bond,
Yes.
Commissioner Jernigan,
Yes.
Commissioner Jordan,
Yes.
Commissioner P,
Yes.
Commissioner Sandlin,
Aye.
Commissioner Schaefer,
Yes.
Commissioner Ely.
Yes. Ms. Neal, Mr. Cruz, thank you for being here.
You're welcome.
Very much.
See you again.
Thank you.
Do I get a cookie too?
Yes.
You could also have some of these down on the lower end.
Part of
here.
my dinner.
Oh, we'll grab more than
Town
one.
council 19.5.
Gentlemen, if you will turn to section 9 in your notebooks, it is time for us to consider our budget calendar. And if you will just take a quick look at the dates, there will be two that we'll call attention to that Ms. Short has highlighted for us. And we can make a decision, if you would please. Notice that the May date is highlighted. May 10th is our regularly scheduled budget committee meeting. So we've been given a choice here. I will remind you that this is the meeting where the mayor and the finance director will give us just a review of the budget and the mayor's recommendation. And for the past 2 years, if I remember correctly, we have been able to do that review of the budget at a regularly scheduled meeting without having to have another meeting. But that will be your decision. So if you will think about that day. And then again, the June 6th or the June 7th meeting. This meeting is a meeting where we will need to have the budget proposal ready for publication and the public hearing. And again, the June 7th is a regularly scheduled meeting. So, are you willing to try to take the work of the budget proposal and add it to our agenda of a regularly scheduled meeting, or would you prefer to do it in a separate meeting?
We done it last year, didn't
We have, and quite successfully, I think,
we? What I think we need to do, save a little money.
and without having to come to another meeting, right? Would you all be in agreement? If someone will make that motion, that is.
Kind of, go ahead.
That is Commissioner Jernigan's motion, yes, to just make that May 10 and June 7. We do have a motion. Do I have a second?
Second.
Second, Commissioner Bond. Discussion, Commissioner Sandlin.
The only thing I was gonna say is it kind of really depends how it starts shaping up down there on what we do. And we can, of course, change it if we need to, but,
That's right. We will have the flexibility.
if we're,
Sometime we schedule a meeting in Kansas.
yes. And so if,
These are major deadlines, so that we have.
yeah, so I think we're okay to go ahead and say this is what we're gonna do, and if
And
we
we
need to
do
change
try
it.
to limit our meetings so that they don't get so long that it becomes just impossible to assimilate all the numbers. But we've been able to do it in the last couple of years.
Do we normally, I know the 29th is usually where we're hit, but it doesn't normally end on a Friday in case we have problems. Is that something we've looked at, or?
It is a Friday.
It is a Friday.
We thought we could if necessarily get back Saturday.
Well, that's what I was getting at, so yeah, we could. All right.
Is that the motivation to get it finished on Friday?
What's wrong with Saturday? Self-employed, you work 7 days a week.
Gentlemen, any other discussion relative to the proposed budget calendar? All in favor, please say aye.
Aye.
Opposed? Thank you, that motion carries. We do have one item under other business, and it is the brick veneer repair at the Rutherford County Sheriff's Department. Mr. Klein is joining us. And Mayor Burgess.
And Mr. Russell can come up here with us too.
Oh, I didn't realize Mr. Russell had stayed with us.
He wanted another cookie.
I want some of these chocolate chunk.
I know. We have discovered while he's passing this out that the extent of the repair and remediation work that we need to do is about twice what we initially determined. I've talked to, I don't believe Mr. McAdoo is in here, but I've talked to Mr. McAdoo and we've contacted all the property management committee members and told them about this and got their permission to bring this on to the budget committee. So if we get this additional money approved, that we can continue the work, or otherwise we would be January the 17th before we could have a direction on where we need to go. And we think it's more than important enough to go ahead and start this discussion and have this discussion tonight. So we're going to let Mr. Klein, I don't know, you may have met David Klein, he's been the architect on this, and he's done other work for us over the years at several locations. I guess you were the person that actually did this renovation work here, is that correct? In the
We did
courthouse?
do the inside of the courthouse.
In any event, we have encountered a highly unusual situation, and we're going to let Mr. Klein describe to you what has caused this and what we must do to correct this at this point in time and prevent what will even be a more difficult and costly repair situation later.
Appreciate everybody seeing me on such short notice, and unfortunately, I'm going out of town next week, so the mayor said, well, we got 2 days. You can either come or we're off until January. The Wednesday before Thanksgiving, we got a call from the contractor. They've been working on the east and the south side of the jail. If y'all noticed the swinging scaffolding hanging off the building lately. They had just started on the west side, which we knew we had some issues with brick, and we identified that brick to be removed and replaced. They said we had a serious rotation in the top shelf angle. I went up on the scaffolding, and what we found was the angle had rotated up about 7/8 of an inch. The way the building works is the dark lines right through here are support shelf angles. I'm sorry, I'll get far enough back if I can see it. So every 22 feet, you've got a shelf angle which supports the brick. That angle supposedly will support the brick above it, and there's supposed to be an expansion material below it, so that as the brick expands, it won't push on the angle above. When they built the building, they did not put any of that expansion in. So what's happened is the brick has grown on the building. So the brick is now at the top of the building about 1.5 inches higher than it was to begin with. And so what's happened is on the first floor at this angle, it's grown maybe 1/8 of an inch, so it doesn't show very much. On the 5th floor, it's grown 1/4 of an inch. 7th floor, it's about 1/2 inch. And on the 9th floor, it's 7/8 of an inch. And what's happened, because the shelf angles were installed with an expansion bolt rather than an anchor bolt, the bolt has come loose and allowed that angle to rotate. Typically, when the brick is installed this way, the brick would kind of break up. It would spoil off along the shelf angle. You'd see a lot of deterioration. This had not occurred because the angle was too weak to hold it in place. If you'll go through the list, the photographs, photograph 3 is on the 9th floor, the shelf angle.
Mr. Klein, quick question. Was this brick installed originally to the specifications that were given to contractors?
Well, I'm not sure.
The reason I'm asking is usually as a contractor, there's a liability there.
That's correct.
And also as an architect, there's liability
That is
there. And
correct.
I'm curious if this was actually installed, and actually how old is this brick material on there?
Completed in 98.
It's less than 20.
97, 98.
So it is 20.
The drawings did not show any expansion between the shelf angle and the brick.
And is that an architectural
That's
mistake?
an architectural detail. That's correct.
Which is a mistake on the architect's fault.
That's correct.
Thank you.
We've never seen the specs, so we don't know if the specs identified that expansion material or not.
Well, with Rutherford County, soils being a high shrink swell,
Unrelated to this.
Not related to all because of the shelving on there, okay.
It's in foundation, all this is just the brick.
Explain to them how brick can grow.
Brick, over periods, takes on water and it grows, but it never shrinks back. So it continues to grow over the years. Buildings in the north, they're 20 stories tall. The brick has actually grown 4 to 5 inches past the windows. The building, you have to think of it, the brick is a veneer, it sits out here all by itself. The building's a separate structure. The brick grows, the building, concrete or block, has a tendency to shrink. So what's happening is it's doing this. And so the shelf angle allows the brick to expand within that capsulation. And so you do that every floor or every 2 floors. So what's happened here is the brick has grown, in this case, 1.5 inches. The building block has shrunk slightly.
But standard procedure would be to put an expansion in there to prevent that problem.
Yes.
And that wasn't installed. Okay.
We don't know if it wasn't installed or it was inadequate.
Well, I mean, it looks like you would see the material there if it had been
There
installed.
was no material there.
Well, if that answers that question, that,
Yep.
I mean, you got pictures of it here. I've been
Would they have
looking
just
at
left a
it.
gap? Would a gap in there, would it, but then you would have to worry about water?
Well, they would have put a caulking in there.
We would have
some sort of
caulked it,
material.
and there are places we found gaps over the windows at the exercise yard, but not on the main wall.
Tell us what we're looking at in 3 and just kind of run down through there if you don't mind.
Okay. 3 is the shelf angle. This is an expansion joint which runs vertical. You see the cut in the bottom. And the angle has started to rotate up.
Yeah.
Okay.
Okay.
4 is a close-up, and you can see the brick on the back how it's pushing on an angle.
We're still looking at this same
place,
but just look
A
at a closer
close-up.
shot. Gotcha.
And you can see how much the angle has rotated.
Mhm.
At this case, the angle has rotated about 7/8 of an inch. The next one shows the brick tie in the eye. When you build the block wall up, there's reinforcing and there's an eye that comes out of that reinforcing. The brick tie lays into that eye, and you can see that very clearly. This is on the 3rd floor, actually. And the brick tie is lined up at the brick joint and hooks totally into the eye. Okay? The next picture is on the 9th floor again. In the upper left corner, you can see the tie. It comes down, and see how little it's grabbing that hook? The hook is grabbing the eye.
Just about out.
It's just about out. If this grows another 1/4 or 1/2 inch, that brick's going to be able to fall away from the building.
Yeah.
Okay. 7 is actually, we had the contractor open the wall at 4 locations on each floor, 3rd, 5th, 7th, and 9th, directly above each other. When they got to the 9th floor, when they opened the hole, they relieved some of the pressure. If you go back to, if you go back to 3, you can see the angle kind of rolls over. When they took that brick out, the angle was able to flatten down a little bit. And so what happened is this section of brick dropped. So this crack occurred when they opened up the wall. Our concern is that if we come in, saw cut the brick, allow that angle to drop, the brick's going to settle unevenly. And then you're going to end up with head joints that are all have to be redone. Okay? The next one, which is number 8, this is a level. You put a level on the angle. The top of the level, of course, is the bottom of the back of the angle, and that shows how much that angle has rotated. So as the brick grew, it pushed on the angle, rotated the angle up. The bolts that are into the wall have pulled out of the wall. Otherwise, the brick would have already spoiled and exploded, bowed, or come off the wall. So that's, in a sense, the bad anchors are an advantage and kept the wall from being more damaged than it already is. Seems a little odd. 9 shows, as you can imagine, if you go back to to 4, you can imagine as the brick pushes up on the angle, the brick wants to also be pushed away from the building. That's kind of logical as you do this, it's gonna want to slide. And so 9 shows, now this is a vertical control joint between the exercise yard, which has windows in it, which is not moved as much as a solid wall. So you can see how far the brick, roughly half an inch, in that case, the brick has been pulled away from the building. And then the final is the old, this is an original picture we took back in February, and you can see where the brick has rolled. There's a shelf angle directly above this brick, and this brick is actually rolled with the angle as it's grown up. Now, in reality, the brick is in very good shape, given what it's gone through. It's in most cases solid. There's very few cracks. In some situations, you might want to come in and take all the brick off and put it back. We don't think it's near that bad. What we're proposing is to come in with clip angles. Originally, what we were going to do is place clip angles over the openings in the building, because we thought everything was sliding down. And we're going to put clip angles in to basically support this, take the load off the lintels. For those, I'm sorry. What we're now proposing is to run support clip angles all along every one of the existing shelf angles. So that will then stabilize them, support them. It'll now carry the brick between them and then saw cut the brick underneath the existing shelf angle. What that'll do then in the future, as the brick grows, takes on water and expands, it'll give it room to grow, and it won't be pushing on the angles above it. And so it'll stop the damage that's been occurring.
And this ain't just on one side, this is...
All 4 sides.
All 4 sides.
It's all the same.
The existing lintels or cliff angles are up there now. The anchor bolts are damaged too much to simply go in there and saw an expansion joint and let them set back down. They would probably
had
collapse.
That discussion.
Yeah.
When we first got into this, it's a little bit unusual. When we first got into it, Mayor Burgess will tell you, we came in and said, we think this is what's occurring. The brick's growing, the building's shrinking, we've seen it before, we've read about it. And we brought in an expert from Chicago who rappelled off the building. I'm sure you've been told this before. He rappelled off the building. This is all they do is brick repairs and exterior building envelopes. And he went in, he stuck his knife in at every one of the levels, and there was space between the shelf angle and the brick. And looking at the condition of the brick, he said, no, that's not what's happening. It's apparently all shifting down. The angles weren't strong enough to support everything, so it's kind of shifted and loaded on itself below. When we opened it up, when the contractor got started, we opened it up, what's occurring is exactly what we thought was occurring to begin with. Everything's growing. What's interesting, he said he's never seen angles rotate from the brick vertically. Williams Restoration is doing the work, and that's all they do. They're in Laverne, and that's all they do in the southeast. They just finished a project in Alabama where they took all the brick off and put it back on. They worked up in Murray, Kentucky, and places like that. They have never seen this before. And probably the only reason that the brick didn't fracture, come apart, was that our expansion bolts, the plans originally called for anchor bolts. The difference is an anchor bolt has a stud, it's laid in the block, it's got concrete around it. The only way it can come out if you pull the wall with it. An expansion bolt is really in with friction. When you get there, you drill a hole, you put the bolt in, it's got a sleeve on it, you tighten it down, it basically, the wedge opens up, grabs the concrete, and that holds it. So it's really a friction connection. Those were substituted. We don't know if the substitution was approved or not. We don't know how it got there. But according to our structural engineer, they are not adequate to carry the vertical load of the brick, the 22 foot of brick. They're just not quite adequate. And so that's the reason we felt like the best way to solve this problem is to put clip angles under it, stabilize it so it can't move anymore. And then we are proposing the 9th floor to the roof. We're going to put in what's called retrofit anchors. They basically go through the brick into the block, and they'll tie the brick to the block. And so where we've gotten the situations like you see in photograph 3, the very top corner, and also 6, we will not be relying on these existing ties anymore from the 9th floor up. Now, the 7th to 9th floor has not moved as much, so that doesn't seem to be an issue. The ties are about halfway into the eye, so we think we're okay there.
You still got to take it all out, though. You still got to take it all out as far as all the brick got to come off.
Not all.
No. No.
Just certain sections, there's
Oh,
200
no.
something pieces and locations.
Okay.
What we're going to do is, the brick is in good shape. I mean, if you go up and look at the building, the fact of the matter is, if you look at it from the ground, you've got some spoiling here and there, but generally, it looks in good shape. What we're going to do is every 56 inches, we're going to put a clip angle underneath the existing shelf angle, stabilize that angle so it can't move, then we'll put the brick back, we'll cut an expansion joint underneath the existing angle so that that brick now can grow. It can now take on water, expand, contract.
Is that just in the affected areas, or is that in the entire building?
That's the whole building.
Because you gotta, if you don't,
We'll be
10
back
years
here
now,
5
you'll
years
be back
from
with
now.
the next, around the corner to the next spot, yeah.
I don't know how much of the history you know, but 05, 06, the original design architect and contractor was asked to come. The contractor made some repairs. They made 3 basic repairs. 2 of those have failed in 6 years or so. So we can not totally fix the problem. We can do a cosmetic. It'll be good for 5 or 6 years probably, and we'll be back to where we were. So what we're proposing is basically to eliminate the problem from here down the road.
Well, the fix you talking about making will be good for,
Theoretically, as long as the building's there, there's no reason it shouldn't
that's
be.
what I was wanting to hear you say.
So is there interior walls in any jeopardy or anything like that?
No, and that's the other
Structurally?
problem. The interior walls were all grouted full of concrete, reinforced. There were no cracks inside, which was the other reason that I think the consultant we brought in said it can't be the expansion, because typically what would happen when that brick grows, it forces the shelf angle to move, which will cause the block to crack that it's supported to. And there's no cracks inside. We checked that. The jail staff have not reported any. I can't say I went into every cell, but I probably went into 10% of the cells and we found no cracking or no structural issues at all. And we had a structural engineer go through the existing building.
Like I said, if it had been the correct anchor bolts, we probably would have that problem.
We had the correct anchor bolts. Either the brick would have already come off the building, or you would have had cracking inside.
Had structural issues in it.
Why do we have to have the brick veneer exterior? Just because we're locked into it because we have it now?
If we had enough failure that we would want to take all the brick off, then you could go back with a driver or some other material. The downside to that is your windows project out 5.5, 6 inches. You've got fans, you've got all kinds of stuff that's part of the building that you would have to somehow address, because your EFIS system, it wouldn't need to be more than 2 or 3 inches. And if we had found, we probably opened the building up in 10 or 12 locations by now. All the ties are there, the 16 inches on center in both directions. Shelf angles are all flashed properly. There's very little rust. We opened them up. Some of the pictures may even show the expansion bolts. When we opened them up, there's very little rust. You can look at the angles. I mean, you know, they're surprisingly, to be honest with you, it's held up, you know, pretty well. The insulation's all there. The waterproofing's there. The gel has not passed on to us any issues with leaking in the wall. We haven't seen any of that. So it's, in every other way, it's performed the way it's supposed to.
So they're not having those expansion joints to let it grow.
Right. And using the wrong anchor bolts.
I hate to ask you this question, but our recourse in that.
What's it gonna cost?
Well, no, that's the next question, but I mean our failure of design right there.
There, you know, I am not a forensic architect.
Right,
You'd have to And your attorney will have to advise you in terms of statute of limitations, because we are 12 years. You could probably make the argument that we had you here in '05.
That's what I was thinking,
The same
yeah.
issue, that may reduce that. I don't know if your contracts, we haven't gone into any contracts or anything like that. I don't know if your contracts had arbitration or mediation in them. If it had either of those, then that is a lot easier than going to court. All parties are still in business. The architect's still in business, the contractor is still in business, and the masonry contractor is still in business. We actually worked with Hardaway and the masonry contractor doing the evaluation and trying to find out what they did when they built it. And that's when we found out that the anchor bolts have been changed to expansion bolts. Now, they told us they had left a 1/4 inch space between the brick and the angles, but I can't say for sure they didn't, but the reality, I don't think they did. Now, the other thing which exacerbated the problem is you went from a standard brick to a jumbo brick. Jumbo brick, because you got less joints, it takes on more moisture, it swells more, grows more. The vertical control joints, there weren't enough, but even what they had probably was valid 25 years ago, and those have all just come totally together. There's no caulking at all between the bricks and the vertical control joints, so that's great part of the problem too. So,
How fast is it deteriorating? Let's put it, I mean,
the only thing I can tell you is that in '05, you replaced a corner, the brick over the entry, right here, brick over the loading dock, right here. These two have already failed. So, and
what's failing now, more so, is it's a hazard.
well, and at that time, no one went up on the building. No one rappelled off the building. No one went more than a couple of 3 floors up. And in reality, if you didn't get above the 5th floor, you probably wouldn't see what was really going on with the shelf angle. And like I said, the consultant we had from Chicago, he didn't notice that this angle would rotate up. He basically stuck his knife in and said, well, I got space. And what was interesting is when the mason called me and I came out the Wednesday before Thanksgiving, they had already opened up both the east and the south side. And I asked him, do we have the same problem? And he said, no, there's space in there, it's fine. And then we went up on the scaffolding and found the same issues. So what happens is when that angle rotates up,
Not that
the
deep.
perception is you look at it and you say, gee, I got a 1/4 inch or 3/8 of an inch, I've got my space. The idea that that angle has actually been forced to rotate up apparently was not something just that hasn't been seen.
This is how many stories is that building?
9.
9-story building. It's the only 9-story building Rutherford County has ever built, in my opinion. You know, the county itself. And if this was a 3-story building or a 2-story building, we probably wouldn't be having this trouble.
That's correct. You
Do
wouldn't.
you have to have does the masonry contractor have to have different certifications to go higher up? Because the guy that's bricking a house out there, you know, could be the same guys end up over there bricking
Well,
you know, and they don't know what they're doing when they get that far up.
Yeah.
Right.
And realistically, that's probably what happened.
Well, it's a combination. I don't know what happened. It's our guess that the mason got to the level, called the contractor, he came in, he put the shelf angle on the brick, pushed it against the wall, drilled the wall, screwed it in, they kept going. I think it was really just a combination of I'm speculating, I can't say what they did. I mean, but certainly I would, they're aware we're going through this process. We have kept all the original parties kind of up to speed in terms of what's going on. They don't know of this situation yet, but they have been aware of it up to this point. But to answer your question, certainly you could go to the attorney and see if it's worth going after. Because we are talking about another $200,000. And that's probably very, I won't say cheap, very economical. The contractor has actually given us the same prices that he bid the project on. In other words, he hasn't made use of this as a way to gouge the county at all. When we started the project, we got a schedule of value, and basically we're doing the same pieces and parts we were doing before. We've just spread them out and added additional. The price he gave us for the clip angles to support the original design was $437, and he's given us that same price. Now that seems like a lot, but that includes taking the brick out, installing the angle. When you install the angle, you have to go into the building, into the cell, because everything goes through the wall. We're not using expansion in this case. We're going to use through bolts. So he's got to go inside each of the cells, so that you can imagine that's very time consuming.
What will they use? Be like a head of a bolt and a washer?
No, on the inside of the cell will be a flat steel plate. There are two studs that we're going to be attaching the clip angle to that will be welded to that plate. So the only thing the inmates will see is a half-inch plate on the block wall. That's it. Nothing to play with or putz with or see if they can break or.
The bottom line is, if you don't go on and fix it, you're gonna get worse than you are now, and it's gonna cost you more money in the long run.
Gotta do it.
And I think this man has been doing an outstanding job. He explained what's happening. It's pretty simple to me. All I wanna know was, who's gonna get the money to fix it.
We
So
just talked
see
about
what we're gonna have to move ahead or not.
restricted for public safety DEA money. Is this not public safety?
Well, first of all, we need as much as $224,000 more dollars. And it could be less than that, but it might be 158, but we want you to go ahead and approve the 224,000 because we want to assume worst case, okay?
Right. We're going to evaluate, the inside corners are a little different, the backup walls, because the shear walls are concrete. They do not, from the outside, look like they have the same level of deterioration. We haven't been able to get in and open those up. When we do, we'll determine then if we need the clip angles or whether we can do what we've got. The structural engineer said the expansion angles in, the expansion bolts in the concrete will adequately support the angles we've got, so we wouldn't need to put additional clip angles in there. But we won't know that until we actually open the wall up.
This is no offense to you, Mr. Klein. This is a question that I have. Since we got the original guys involved in 05 and 6, why didn't we get them involved on this as far as this project itself?
We actually did get them involved. We had Hardaway and Shaw Jones, who was a masonry contractor, and we let the architect and the structural engineer of record know what was going on. Hardaway and the masonry contractor were helpful. They gave us whatever information they had, but we had to pay them to do the testing. And they're not going to, on their own, my opinion is, on their own, they're not going to come in and basically spend $300,000 or $400,000. I could not get any response out of the structural engineer. The architect did respond, but he couldn't find us a set of specifications. So we don't know exactly all the details in terms of the original contract. The specifications are different than the plans. We have the plans, but specifications can outline or stipulate details that aren't on the drawings. They both constitute the contract, both the specs and the plans. So I think they've been involved. Reality is they did give an opinion. I got a copy of it the other day in 05, and their opinion was it was just normal settlement and minor cracking and wasn't an issue.
What's the mayor's recommendation on where we get the money?
Ms. Nolan is doing this, and
You've got two choices. You've got the restricted for capital projects, which is the development tax, which we're estimating now, with all these other changes, down to about 1.6. If you take another
200 plus 224. You pull that down to $1.4 million.
Right. Then the other one is fund balance.
Well, a while ago, we
Unassigned
changed the
balance.
name, and Mr. Russell's not gonna like this, the forfeiture fund. And a month or two ago, Mr. Baum asked a question. We were told we couldn't use the forfeiture money for anything but the drug type stuff. But then we were sent some information that we can for public safety, for operation and maintenance of the jail. Could we use some of that money?
I think the recommendation would have to come from the sheriff to use that money. I don't think that money,
We can't.
I don't think you can direct where that money will be spent.
We approved putting it in that account 2 months ago.
No, that's where it has to go.
Yeah,
I mean,
yeah.
that wasn't a choice.
Yeah.
It has to be set up in a separate account.
But some of that
Very
money could be used.
Could be, but, I mean, from my understanding, the
The
sheriff is
the one
gonna have to
the one
bring
that
it to the
has to
table.
approve that, to do that.
I don't
Sheriff
believe
want
that
his
you
jail
can direct.
A nice tin veneer would look.
Well, what are the sheriff's feelings on the subject then? Maybe we
I
haven't,
have,
we haven't spoken at all to him?
Well, we've told him about it, we haven't asked him or instructed him about where the money should come from.
Those funds are typically used for things not of this nature. And they're
But we
pretty-
were
they're
told
pretty
that night at the
sensitive
meeting
about
they
it.
couldn't be
No, I know,
used.
and it's not that it
I know,
can't be, and it's
but-
not that it
but-
can't be.
'cause-
But it's just typically not used for
Yeah.
things of this nature.
Yeah.
And they do rely on these funds to do offline things that they have to do for narcotics and all this other stuff that they do to be able to accomplish. And as you saw tonight, 1 month we hit the lottery.
Absolutely.
And the next month, there's no money.
I just want to make sure we've all got the same information all,
Yes, sir.
because we were
Yes, sir.
told fairly directly we couldn't use that money.
Right.
And then we were told the next few days that money could be used, possibly. And so I just want to make sure we've all got all the information out there in front of us.
But it's
So it may not, it
directly
hadn't
from-
historically been used for that,
Right.
and maybe across the
Right.
country and other places use that money for that, but that money isn't quite as tightly bound, as at least I believed in the past.
Right, the uses for it, I think, are a little bit broader than I think what the original understanding is, but it's still under the direct control or direction from the sheriff. He has to approve everything.
If he wasn't using them money to do what he's doing, otherwise, he may be coming and asking you money for some of the things. It's being used in the sheriff's department regardless.
Yeah, we're not throwing undercover parties or
What I'm saying
going on
is
undercover
that,
vacations.
We'll make sure we get that out on the table tonight. It don't look like it.
Elisa thinks maybe we should go with the development tax at this point. If we used the ending fund balance, it would reduce your percentage of your reserves from 16.8% to 16.3%. So you're going to drop your reserve percentage about a half point. And it's probably not too much. 16.3 is probably still okay, but we're getting ready to have the rating agencies, so we sort of like to leave that as high as we could.
If you use
Right now.
development tax, how much money you have left in it?
We have about $1.4 million left.
Now, what's the number we're looking for right now? that you-
224. We
224.
we hope we can get that less, but we don't know until we continue this journey.
Because we've already got
Can we make a
two in there.
motion
What do we got?
that we use the development tax and request that the mayor and the sheriff have a tete-a-tete on maybe a 50-50 split?
How much have we already approved this project?
We can do whatever you want to ask us to do, we'll try it, but we like, next Thursday night, we need to get this resolved, or we can't continue the work.
So, do you plan on talking to the sheriff just to see what his feelings are?
I will talk to him.
Well, then I'll make a motion that we pull $224,000 from the development tax, or whatever its correct name is right now, to go to the brick remediation to square away the jail.
It's the one on page 2.
And we have a second from
What was the
Commissioner.
number?
Mr. Klein, did I understand you correctly on how long this fix would last?
Pretty more records, huh?
Theoretically, it should.
No,
it
I
should
want it
be-
on ink. I don't want it on.
There's no reason it shouldn't be permanent. I mean, basically what we're doing is, what we're putting in is adequate to support the brick, and by giving it the expansion relief, then the brick can kind of expand and contract on its own. So unless something unusual happens, there's no reason that this isn't a permanent fix. It should be there as long as the building is.
Well, that'll be in our contract, I assume.
I don't think
I
that'll be in
can't
anybody's
give,
contract.
yeah, I can't give you won't have any insurance, it won't do you any good.
Well, I'm asking
But I
about what kind
understand.
of, I mean, there's typically a warranty of some type on
Well,
a
we
work like this.
have insurance, we have E&O insurance, and basically will cover what we're doing. But if, for example, if in this process we don't find some areas where the brick ties have come loose, they don't show up, and 3 years from now a section of the wall comes out,
Well, I wouldn't.
we wouldn't.
I wouldn't expect you to be
Right.
liable
But
for
what
stuff
we're
you have
doing,
done.
we have $1 million in E&O insurance, and the work that we do is fully insured for the design part of the work. And the contractor obviously has his warranties that go with it, so.
Typically, how
Now, if
long?
you wait 12 or 14 years, I doubt if my insurance company will.
Typically, how
will
long
cover it, but-
is a what statute of limitations?
You know,
I'd
I
always
think
heard-
it's 5 and 7, but don't quote me on it. The county attorney would probably need to respond to that, but I think it's 5 years for what they call physical damage and 7 years for personal damage. In other words, if the brick falls off and hits somebody on the head, it's a 7-year. If the brick just fails, it's 5 years. And I don't know the detail of that. You would need to talk to the county attorney. I frankly think it would probably be worthwhile to approach the contractor and the folks with, here's what's happened, and you need to talk to the insurance company, whether there's any validity, I mean, because of the time, whether you can actually go through the litigation process and, you know, if you got the $450,000 back, it may cost you $250 to get it, so I'm not sure it's worth it, but, and you would need the consultants we used on this are the office we work with are out of Chicago. They do a lot of forensic type stuff, but that's a whole different fee structure, and you know, you're gonna pay guys $300 an hour to come in and tell you stuff.
The guy that fell off the building that said he'd never seen this happen before.
He said it wasn't a problem, the one that rappelled off the building, and
Well,
told you were wrong, and actually you were right, yeah.
In all fairness, I mean, I understand, you know, when he was looking at it a foot away from it, there's some light. And I said the contractor basically on both the east and south side, they had already pulled all the caulking off, opened the wall up. And they said, no, they're fine, until we started getting over and looking at it and realized the same thing was occurring. So it's not a simple solution. You know, it's not something, it's one of these aha things. It is complicated, and frankly, I don't know that I'm aware of any place where the angle is actually rotated like that. As I said, typically, I mean, you know, logically, it's kind of, think of the brick like ice. When water freezes, it expands. Well, the brick does the same thing, and it doesn't make any difference how strong something is. It's going to break when the water freezes. The brick's kind of the same way. When it takes on water and expands, nothing's really going to hold in place, and it's going to bust things. And frankly, what it was breaking was behind the wall. You couldn't see it. It just, you know. And I know that the county looked at the brick on this building every couple of years for the last 7 or 8 years, and you get a little bit here, a little bit there.
So is picture 3 and picture 10 the same picture?
I think they are. One was showing just
that was in
the angle.
February, and then this was just here recently, right?
No, all of these are recent except the very last one.
Yeah, that's
10
what I
was
was
the only one. Yeah, 10 was back in February. And that's actually opened up a little more now. This is on the west side. And that's the one we'd like to do first, obviously. It's the worst side.
Well, we got a motion on the floor?
We do have a motion and a second. Do we need any
And
further
that's-
discussion?
And that's right now coming from the development tax.
Yes.
But we're going to approach the sheriff and say, hey, it's your building. We need some of your money to fix it. Is that what we're doing?
That's what we're gonna do. Now, if he says no, then what you're voting on will come before the commission next Thursday night.
Any portion will be appreciated.
Because budget is just right around the corner.
Yes, it is.
We've worked pretty good with the sheriff's department.
Oh, yeah. And I'm sure he'll work with us.
September
We
2000.
need to be trying to work in good faith to the three.
Gentlemen, any further discussion relative to this motion?
One other question too is, who is going to contact our attorney to have him look into this as far as any liability or?
It'll have to be me.
All right. I'd like to.
The hard part about this is we can't get a hold of all the records. We can't even find the specs, which are critical to this discussion. They're not available. At least they've not been found to this point.
No one's offered them.
Even the architect originally says.
If I was them, I wouldn't need it.
There wouldn't have been a pair, we just heard this in Health and Ed the other night about when a school is built, Mr. Clardy's got files with the marked up architect designs on every building. I mean, would they not have handed over a set of the?
We would have had a set of specs originally. The county would have had those.
And then the marked up, I'll use what you call the ones, the construction drawings. As built, yeah. They should have been handed over to the county at some point in time.
We have the drawings. We have the as-built drawings, but we do not have the specs. The sheriff's office does not have them.
I'll look in Virgil Gammon's office, he may
They
have
have
some.
looked.
No.
You've got a copy of
Repeatedly.
Okay.
In all fairness, our firm's been around since '56, obviously it hadn't been there that long, but we keep everything, and frankly, we get calls on a regular basis from municipalities and school boards and saying, do you happen to have the drawings or the specs or the file on this project you did in '58 or '62? In fact, we just supplied some plans for the old fire hall, which I think was built in '63 in Murfreesboro.
By the city.
Lyle Lynch, yeah, for the city. So we keep that, and you know, it's hard for government agencies to.
Sure.
You get change in staffing, and it's hard to kind of keep track of it. Frankly, Ben Manskin's got a better system down there than most. He's got all the plans. I mean, they're in fairly good shape. It's not that old. The architect and the engineer should have it. The contractor, who is Hardaway, did say that they purge their files every 7 or 8 years, and he went and looked. He said,
Same time the liability runs out.
probably.
Gentlemen, any further discussion? Call the roll, please.
Commissioner Bond?
Yes.
Commissioner Jernigan?
Yes.
Commissioner Jordan?
Yes.
Commissioner P?
Reluctant, yes.
Commissioner Sandlin?
Aye.
Commissioner Schaefer?
Yes.
Commissioner Ely?
Yes.
At least it's an unfunded mandate.
Mr. Klein, thank you.
Thank you. I appreciate it.
Mayor Burgess.
What a Christmas.
Gentlemen, is there anything else that needs to come before our committee?
I'm going to do that, sir. Yes, sir.
We are adjourned. Thank you very much.